Hello, Chick Collins from the University of West of Scotland. Just to go back to to Claire's presentation initially and the little bit from the Goons. I'm imagining myself in Western Bartonshire on the 1st of April 1996, and the question is put, what are you doing here? And the reply is, well, everybody's got to be someplace. And someone in Western Bartonshire at that point could have said, well, this is a place I would never have imagined myself as being. And in fact, there has been a lot of discussion about the creation of this local authority that says that in fact Western Bartonshire is a place where no one should be. Yep, because we shouldn't create local authority boundaries in a way which concentrate poverty in order to constitute a kind of a place where it's highly unlikely that a place-based initiative could ever work. And in fact, you know, the people in government at the time were specifically warned about this. And this applies not just to Western Bartonshire, but to the whole local authority map of Scotland and the boundaries of the community planning partnerships. Douglas Fraser in 2006, writing in the Herald, said that the local authority boundaries were testament to a naked exercise in political gerrymandering. Stirling was created incredibly sympathetically because it was Michael Forsyth's constituency at the time. Yep. East Ayrshire was a place that probably shouldn't have existed. Eastern Bartonshire. Why does Glasgow exist as the kind of boundaries that it currently does, that it currently has, and can it ever solve its problems within those local authority boundaries? So I guess the question here is, do we need to reconstitute the places in which we attempt to have our place-based initiatives in order to give those place-based initiatives the possibility of being able to work where the problems are most acute?
There's a lot in that, but we'll take another question to add to it, to give the panel some time to think about how they might respond. There was somebody had their hand up down here. David?
Thanks. David Walsh, Glasgow Centre for Population Health. This is an easier question. It was just for Chris. You talked about the importance of life course evaluation, and the obvious point, I suppose, is that if this started in Venezuela 40 years ago, has there been a long-term follow-up and evaluation of that there since then?
Okay. Claire, shall I ask you to respond on the issue around place? So the question being around whether we've essentially created the problem of place-based problems because of the way that we've constructed our boundaries, and whether we need to address that rather than dealing with the issues that come up.
I think this is a crucial issue. I think it's probably the one that's the most ignored in all of this. There's an awful lot of focus on community empowerment. I think we would talk a lot about prevention, and so there's other rationales for place-based approaches. But actually, what place-based approaches are trying to do is fill an enormous void they're set up for failure, effectively, because of our local democracy. I mean, one of the most centralised systems we have in Scotland. I mean, it's absolutely shocking to me when I discovered that ratio. One councillor is supposed to represent 4,270 people. That cannot be done in a meaningful sense. So I'd agree 100%. I think that this needs to be discussed. I do understand there might be coming forward some reform around local government, but whether or not that's going to look at the boundaries, I'm not sure, but I think it's a significant challenge, and I entirely agree with Chick's point.
And it strikes me that there's some echoes with the debate earlier around the differences in gender, where we assume a degree of choice that might not exist for people in terms of where they live and what's taken them to those places in the first place. Chris, do you want to respond to the question about Sistema?
Yeah, there has been a range of evaluations from Venezuela primarily. I think methodologically they're quite weak, to be honest. So it would be short-term evaluations looking at, again, predominantly qualitative methods, which is fine, but making quite grand statements about the impact. When you get underneath them and you look at actually what's been done, there hasn't been anything of the nature that we're doing. But I guess the important point is that we've we've tried to learn from those evaluations, and we're trying to improve on the quality.
Okay. A couple more questions. I've got two on this side, so there's Jerry there.
Hi, it's Jerry McCartney from NHS HS Scotland. Just a comment on Denise's presentation, which was excellent. Denise, one of the things you noted was that the peak age at which inequalities were occurring has increased over the period 2001 to 2011. And I guess just relevant to that, we've been doing some age period and cohort analyses looking at particular causes of death, most recently suicide, where we've seen fairly clear evidence of cohort effects of people entering the labour market in the 1980s and 1990s. I wondered if you might want to comment on what implication of that might be with the results you were showing.
Okay. I'll take three because two other people had their question up. You've moved to confuse me. That's a question here. And then we'll take Bruce.
I'm still Mark Langdon from Glasgow Life, Family Learning Officer. I've just moved seat. Get another question. I'm really interested in the term community empowerment, and that was one of the things that the Systema was setting out to influence. And I'm interested in the panel's understanding of how we measure community empowerment and how that relates to local democracy, and whether there was an indication of higher turnout, in an area like Rathloch as a result of engagement with Systema, and that really about the critical analysis of the concept of community empowerment when we are in a situation of austerity where there's arguments to say we're in a post-democratic state. So actually, how empowered are communities? I know this is a big question, but you get where I'm coming from. And when you're setting yourself up, are we setting ourselves up to fail in terms of a process which looks to empower communities when actually the decision making is reducing power, and there aren't changes to things like the kind of democratic infrastructure that we have at the moment?
Okay, and one more question from Bruce here.
Yeah, this is about, I guess, the place-based approaches and the kind of contrasting what Claire was describing from what Ali and Chris was describing. But you both in both talks you touched on the importance of how you engage with kind of participants, with communities. So my question is really, what's your feeling about the importance of learning about the most constructive ways to engage in place-based approaches?
Okay, so we've got cohort effects, community empowerment, and effective ways of engagement in place-based approaches. Denise, do you want to comment on the cohort effect?
Yeah, the cohort effect is something that we've been discussing and are trying to think about just now. So we saw the peak in the mountain plot shift from about 30 onwards to about 40 onwards in 2011. Both in terms of suicide, but also we think there might also be one in relation to alcohol and drug as well. When we looked at the table showing the different ages, we also saw that the largest reductions in 2001, or the least reductions, were for the 15 to 29 age group, and that also seems to have shifted to now become the 30 to 44 year group. So it's something that we will be looking into, especially in relation to those causes of death.
Okay. Claire, Chris, Alison, do you want to pick up the issues of community empowerment and engagement?
Okay, yeah. So the first question around are communities empowered? How do we measure community empowerment? Okay, it's not neat. These are big questions. What I think about it reminds me of something I read from GoWell. They looked at the evidence and they said actually they cannot see any evidence of community empowerment, community engagement processes run through local government leading to robust evidence of community empowerment. So that we've got this notion that by doing community engagement we achieve community empowerment. But actually when we think about the most empowered communities, they're not necessarily ones where there have been a lot of people doing a lot of engagement in public service reform. Being involved in the governance mechanisms of a place-based approach doesn't necessarily empower communities. It may keep them quite busy and occupied with piles of papers at meetings, but does it actually realise these assets? There's two sides to this empowerment agenda. One side sounds wonderful. That's about animating assets. It's about mobilising people, realising that there is potential in neighbourhoods that's underused, underdeveloped. There are buildings that people could make better use of, land they could make better use of. And I find that a very positive narrative. At the same time, there is an agenda about passing responsibility for austerity, public service cuts, and a number of huge agendas, passing that responsibility from the state, from senior management to frontline professionals, and then on to communities. So my answer is, I don't know how we measure it. I suppose we have to measure it by asking the people in the places that we're interested in. On the how to engage effectively with place-based approaches, with people working community planning partnerships, we've looked at a number of ways of doing this. Now, when we set up What Works Scotland, our method is collaborative action research. Now, the idea of that is that we establish small groups of people from different public services, voluntary sector, working together on an issue, for example, like welfare reform or like schools improvement programs. We work with them on addressing a particular issue. We establish what is the knowledge gap, and they are involved in conducting the research with us as action researchers supporting them to do that research. What Works Scotland was set up to do that type of research. The Christie Commission talks about creating new spaces for collaboration. In practice, it's very, very difficult to get the sign-up for staff to come out and do that type of work. We found it much harder in practice than we thought it might be. Even in a conducive policy context, it's tough. The other way that we're working with community planning partnerships, which sometimes is easier to get the buy-in, is around bringing resources, tools, and capacity building. So where you've got a good tool, a good, so I was looking actually recently at the Place Standard. If you've got a tool that people can work with, they can integrate it into their programs, that may help solve a problem that they're faced with. One of the tools we found most useful was the profiles. I was really surprised. I went to a meeting the other day and the senior manager said, it's not so much that the data's new, but that we can put this on the table and it's a call to action. We can say, here's the data, what are we going to collectively do about it? The other way in which they're talking about using data is as a way of starting a new conversation with communities, that you can take the data and you can meet with a community group and say, look, this is only a partial picture of where you live, so tell us the rest that's missing, so we can build a holistic picture of where you live. So those are a couple of thoughts on engaging in practice with community planning.
So Chris, Alison, anything to add on either the issues of community empowerment or on engagement?
Yeah, I mean, I suppose just coming from a very practical-based background and not really answering the question again, but sort of commenting on it a little bit, I find it fascinating working in Govan Hill here in Glasgow. It's a very multicultural community, for those of you who know it, and I feel like there are empowered communities within the community of Govan Hill. There's a lot of strength there, there's a lot of history, but I feel that the community is fractious, and that one of the things that I would like to see is, and other organisations working within the community, is that community being as one, the geographical area of the people who live within it. But I find it fascinating looking at how we might be a part of that as well in the big noise. I suppose on the how to engage and how you might learn about the place that you're in, and the most constructive ways to engage. I suppose as well, being just part of this very practical programme, working with something that we are really good at, and knowing and feeling very confident in what we're delivering, and sticking to something that we are good at and we're so passionate about. And so if you have passionate people in front of you delivering something, it is easy to get caught up in it. And using music, it's I know, so this is what we're about, but it's a long-term, it's not easy. It takes you time to learn music yourself, and it takes time to learn to play with other people. And it can be very joyful and emotional skill and art form, and it's very disciplined at the same time, especially when you're working in ensembles. So I think it has major benefits in that sense. But I think from a personal perspective with what we deliver, we're very confident in what we do, but we're looking to other people who already work to engage in the areas to give advice on how we can use what we do in slightly different ways. And again, Govan Hill is a very interesting area with lots of different music from different places, but different opinions about music as well, and how people might engage with it or not. So yeah, forever learning, I guess, on that one.
Okay, time's marching on. We'll have time for more questions and discussion over lunch. I know there's one or two more people that wanted to ask questions, but if you can hang on to those and perhaps grab a panel member later on. I'm going to hand over to David Crichton from Health Scotland to come up and say a few words. Before I do that, can we just say thank you to our 4 speakers from this afternoon. So thanks very much.
Thank you, Lorna. Hello, everyone. It's been a real pleasure being here this morning. It's my first of these conferences. I know this is the 12th or the 11th. I've thoroughly enjoyed it, learned so much from it. The first thing I want to do is that I know when I hand back to Lorna, she'll be, again, thanking the speakers, thanking the organisers who've made this such a great event. I'm pretty sure she won't be thanking herself. So can I take this opportunity just to thank Lorna for her chairing of the event, for keeping us pretty much on time, and for making such smooth links between the speakers and the sessions. Lorna, thank you very much. I wouldn't do justice to what we've heard this morning if I tried to sum it up, so I'm not going to try to. But there's 2 big points that I'll certainly be taking away from the sessions, and I'd like to share them with you. The first is the power of example, the power of good examples to tell the story. We've seen some fantastic presentations this morning about data collection, data analysis, and what it tells us, from Martin, from Vital, from Denise. And, you know, I trained as an economist myself. I love that sort of stuff. There's nothing we love more than capturing huge amounts of data, dragging it down to the basement, torturing it with Excel until it tells us something, till it spills the beans. And that's great. That's what gives us good decisions. That's what gives us better policy. But it's examples and stories that actually capture the public's attention and the politicians' attention. And we've got some great examples of those today as well. I was struck by one of Anna's slides, which was headed, let me get it right, Indicators Need Stories. And I couldn't agree more with that. And she used those advertisements, if you remember, for the boys dressing up box and the girls dressing up box. And I looked at that and I kind of laughed at first, as we all did, and then it struck me, that's the sort of advertising I was getting exposed to when I grew up. And that's 50 years ago. Who am I kidding? It's 60 years ago. And if it's taken 2 generations and we're still getting these that type of advertising, then it shows just how difficult a job we have to make those changes in perception, changes in practice. So that was a great example. The Sistema story, sure, it's inspiring, it's visionary, it's moving, but it's also effective. It has an impact on people, it has an impact on communities, on their health, their well-being, on their education, and ultimately on the economy and inequality as well. So let's not forget to use those stories as much as we can, because there's hundreds of them out there, and you all know them, you're all involved in them. And before I finish on that, let's not forget the bad stories as well. Lorna mentioned Sports Direct in her introduction. And if anything shows the potential impact of bad working practices on people's health and well-being, then it's that example. And by the way, isn't it telling that it took some bad publicity and a fall in the share price before that surfaced? So that again tells us something about how we track and monitor and deal with situations like that. So never forget to tell the stories, good and bad ones. The second point I'm taking away is a reflection on how public health is delivered in Scotland. We had the public health review earlier this year. We don't know yet what the eventual outcome of that's going to be in terms of how public health is delivered. But whatever does come out, we'll live with it, we'll work within it. But whatever does come out, my main hope is that it gives the respect, the recognition, the influence that good public health science and talented public health professionals need and deserve. We're embarking on major transformational changes in the health service at the moment. The health and social care integration, the shift from acute to primary care, the shift to realistic medicine. None of that is actually going to work unless good public health science analysis and good public health practice are able to influence it and steer it and monitor it. So if I have any influence at all on how things develop, it will be to keep reinforcing that message. Make sure that whatever structures, whatever delivery mechanisms we have, give the space and the platform for good and effective public health science and practice. So that's what I take from today. As I say, it's been a fantastic morning. Thoroughly enjoyed it. Thanks for all your participation, questioners as well as presenters. Lorna, over to you.